My name is Dr. Srivastav. I work for Fortis ESCORTS Heart Institute. I am currently the Director of Non-Invasive Cardiology and I head the research department here too. There is a lot of confusion which has occurred after 2014 December because some new guidelines have come. Earlier, the severity of mitral stenosis was considered if it was anything lesser than 1 centimeter square. But with recent guidelines, now lesser than 1.5 centimeters squares is considered as a severe mitral stenosis. Regardless of what the severity is, the first and foremost thing which governs your intervention is symptoms of the patient. If the person is symptomatic, even if it is moderate valvular heart disease, that needs to be corrected. Once it reaches the current guidelines of severe, then certainly you have to start thinking in terms of intervention. Now, mitral stenosis is something which is a very peculiar thing because pure mitral stenosis occurs in India more often than not in rheumatic only. And this rheumatic people, they are most of the times very young people. And you don't want to give an artificial valve to these young children. Because the moment you give an artificial valve to young children, you are forced to give a metallic valve. And the moment you are forced to give a metallic valve, all life long they have to be on blood thinners and the coincident complications of blood thinners. All of us know that blood thinners have to be very meticulously managed. If the blood is thicker, then it can lead to choking of the valves or stroke. If the blood is thinner, it can lead to bleeding diathesis. So best thing for a mitral stenosis that is also pure mitral stenosis without much of mitral regurgitation is to balloon them and open up the valve. This can buy them several years, and for few patients it can buy them decades also of without going in for a major intervention like surgery. Problem comes when patients are asymptomatic, and here the importance of objective evidence comes. If it is a severe mitral stenosis, pulmonary artery pressures are going up, there is some evidence that atrial fibrillation has come, or there are some other complications like stroke or infective endocarditis which has happened, then these become candidates where intervention should be planned even if they are not symptomatic.